Dear students, look at the image. So from which part of the body it is? Let us discuss the structures in relation to this area. So now, can you identify the area? This is the palm of the hand you are seeing. So which side it is? Whether it is the right palm or the left palm. And you focus onto the digits. So this is the little finger, thumb. This is the thumb side. And then this is the palm of the hand, and where you can see the muscles. So here a group of muscles, here also a group of muscles, and then you are seeing a thickened fascia and a nerve. And see whether you can identify these structures and answer the related questions. So what is this area? What do you call it? And then what are the muscles located here, their nerve supply and action? Then look at this part. And what is the muscle? And what is the peculiarity of this muscle when compared to the other muscles in the palm? And what is its nerve supply and action? Then what will be this area and what do you call those muscles? Then their nerve supply and action. Then if you see, what is this structure and what are the muscles attached to it? What is its function? And what do you call the clinical condition associated with this structure? Then look at the structure. The arrow is pointing, and then what is its distribution? So these are the questions, and you are seeing the structures. Now try to answer these questions. Now look at the first question. So what do you call this area? This is the thenar area, and these muscles are the thenar muscles. And what are those muscles? So they are the abductor pollicis brevis, then the flexor pollicis brevis, and in a deeper plane will be the opponens. And there is a muscle called adductor pollicis, which is having an oblique head and a transverse head. So they are concerned with the movement of the thumb. And then what is their nerve supply? So the abductor pollicis brevis, then the superficial head of the flexor pollicis brevis, the opponens pollicis, they are supplied by the medial nerve, whereas the deep head of flexor pollicis brevis and the adductor pollicis, they are supplied by deep branch of ulnar nerve. Then what is their action? The abductor pollicis brevis, as its name implies, it abducts and then medially rotates the thumb, whereas the flexor pollicis brevis flexes the thumb. The opponens is concerned with opposition of thumb, bringing the tip of thumb in contact with the tips of the other four fingers. Then the adductor pollicis, so adduction of the thumb, that is bringing the thumb in contact with the other fingers. So that is about the thenar muscles, their nerve supply and action. So answering an MCQ, this type of questioning and recalling the answers will benefit you. Now let us look at the next question. So the structure which you are seeing, it's a muscle. And what do you call that muscle? It is the palmaris brevis muscle, and it is a subcutaneous muscle. So that's how it differs from other muscles. So you must have learned about the panniculus cornosus. So they are the subcutaneous muscles. So one example for the panniculus cornosus is the palmaris brevis muscle. Then what is its nerve supply? It is supplied by the superficial branch of ulnar nerve. This is an important MCQ question for you. So the palmaris brevis is supplied by the superficial branch of ulnar nerve, whereas the majority of the intrinsic muscles of hand, they are all supplied by the deep branch of ulnar nerve. Then what about its action? It causes sprinkling of skin over the hypothenar eminence, and this facilitates better grip or holding of a object, and this also facilitates deepening of the hollow of palm. When you want to put some liquid into your palm, you will deepen it. So the deepening action is by the palmaris brevis muscle. Hope you have understood the importance of this slide and then the question on the palmaris brevis muscle. Now look at this question. Can you identify the area of these hypothenar muscles? So what are the hypothenar muscles? So they are the abductor digiti minimi and flexor digiti minimi, and in a deeper plane is the opponens digiti minimi for the little finger. And what is their nerve supply for these hypothenar muscles? They are supplied by the deep branch of ulnar nerve. And what is the action of these muscles? As their name implies, their action is on the little finger. So abduction of little finger by abductor digiti minimi, flexion of little finger by flexor digiti minimi, and then the flexion and lateral rotation of fifth metacarpal by the opponens digiti minimi. So that is about the hypothenar muscles. Now look at the next question. So what do you call this area? You are seeing a triangular area which is a modification of the deep fascia, and this is known as the palmar aponeurosis. Then what are the muscles attached to it? One is the palmaris brevis, which you are seeing. Then the palmaris longus tendon. So it is nothing but the continuation of palmaris longus tendon is the palmar aponeurosis. This is also an MCQ question for you. Then what are the functions of the palmar aponeurosis? So it facilitates the grip by fixing the skin of palm. So that's how it improves the grip of hand. Then another thing is it protects the underlying structures, that is the tendons, the long flexor tendons of the flexor digitorum superficialis and profundus are there. Then the vessels, the superficial and deep palmar arches are there. So immediately next to it is the superficial palmar arch, and then the branches of the median and ulnar nerves. So the palmar digital branches are there, and in between the tendons of the digitorum superficialis and profundus, you will be seeing the umbilical muscles. All these structures are protected by the palmar aponeurosis. Now let us look at the last question in this session and look at the arrow. It is showing a structure. What is it? It's a nerve. And what is that nerve? It is the superficial terminal branch of ulnar nerve. Then what are the structures it will supply and what is its distribution? It has got both motor and sensory distribution. So can you think what is the muscle that is supplied by it? Because it is having the motor component. It's the palmaris brevis muscle which it will supply. Then the sensory distribution to the medial 1.5 finger. That is, it will be supplying sensory branches to the little finger and medial side of the ring finger. So that is the distribution of the superficial terminal branch of ulnar nerve. So hope you have understood and feel that it is of use for you in answering the MCQ questions and image based questions if they are given in your examination.